me, and I'll be your nurse today. Can you give me your name and birthday, please?
Zaid, February 27th, 2005.
All right. Just going to look at your band here. It looks like we have the right guy, Zaid, of February 27th, 2005. So I'm going to wash my hands before I start and get my germs all gone. So today, like I said, I'm just going to be looking you over from head to toe, making sure that you're growing properly and that you're healthy. Are you in any pain today?
No.
Okay, good. So before I get started, I would make sure that Zaid would empty his bladder so we don't have any interruptions during the exam, and it can go quickly. I'm not going to be having to poke you with any needles or anything today. No shock. It's a painless exam. So just looking over, like I said, and making sure you're healthy. I will have to ask you to take off your shirt halfway through just so I can look at your belly and your chest, but I'll let you keep it on for now so you don't get cold. I would start by looking at Zaid and seeing that he is aware and he is in proper alignment. I don't see any slouching. He looks like he's growing well for his age appropriately. I don't see any signs of obvious drainage, scarring, bruising. His skin is well moisturized, no dryness or cracks. I'm also just going to ask you a few questions, Zaid. Can you tell me, is it around breakfast, lunch, or dinner time? Around lunch, okay. And do you know what today is? Is it Monday, Tuesday, Wednesday?
Sunday.
It's Sunday, okay, good. I'm just going to have you read a sentence out of this book just to see your reading level.
When September comes around, you can play hot tune on your very expensive new Juke-a-Magen. I wish you could play it in May or in June, but May is too early and June is too soon.
Good. It's a good book, huh? So what grade are you in? Fourth. So are you in school every day of the week?
Yeah.
Monday through Friday? So you're busy. Well, I was just able to locate that he is oriented times 4 to person, place, time, and circumstance, and he's able to read a simple sentence and follow directions properly. At this time, I could record his height and weight and compare it on the growth charts. I also could take his vital signs, getting his temperature, which would be anywhere from 97.5 to 98.6, along with his heart rate between 70 and 110, and his respiratory rate of 16 to 22 per minute. And at this time, I could also get his blood pressure, which would be anywhere from 102/61 to 115/75. But we're not going to do any of that today. We're just going to go ahead and get started. So I'm going to start at your head and move down to your feet. First, I'm just going to feel around on your head here. Is there any pain when I touch?
No.
No? Is it ticklish at all?
Yes.
Kind of. You have some pretty long hair, huh? But I don't see any, it's evenly dispersed throughout. Your scalp is pink to tan, which is what we're looking for. I'm going to look behind your ears, make sure there's no creatures hanging out back there. Nope. Good, so it looks good. Next, I'm going to go to your face. I'm just going to look at his skin. He's got a few freckles. It's pink to tan in color. No signs of dryness. I'm going to start by having you raise your eyebrows and then lower them like you're mad. Good. And can you smile for me? And then frown? Good. Okay, next I'm going to start by looking at your eyes. So I have this light. I can let you shine it in my eyes to show you it's not going to hurt at all. Just going to look around and make sure everything's moving properly, okay? So I'm going to start by having you look straight forward. I'm going to shine the light in this eye. Good. And now this one. Good. Now I'm going to have you follow my pen light. So keep your head straight and still and just follow with your eyes, okay? Good. You're able to move your eyes without moving your head, so that's good. And now we go cross-eyed there for a second. So that's all working properly. Do you have any pain in your eyes at all?
No.
No? Okay, good. You have long eyelashes, and the white part of your eye looks dry, or looks moist. Doesn't look dry, there's no redness, so that's good. I'm just going to pull down on your eyelids for a second, okay? And look at the inside of your eye. And they're pink and moist, so that's good too. I'm going to look in your ears now. I don't see any signs of drainage. There's no wax. You must do a good job of keeping them clean. Good. Do you have any pain in your ears at all when I touch them?
No.
No? Okay. I'm just going to whisper a word. I'm going to have you repeat it so I can test your hearing, okay? So,
Pineapple.
good. Good. So you can listen to my commands well and you can respond with the appropriate word. Next, I'm going to look at your nose. I'm just going to push in on one side of your nose and have you take a deep breath in and out so I can feel the air coming in and out. Good. Good. Yeah, don't have any boogers up there because I can feel the air coming out. And I'm also just going to look inside. I don't see any signs of drainage. Next, I'm going to have you open your mouth nice and wide and stick your tongue out and say ah. Good. I'm going to look back at his pharynx. I'm looking at the inside of his mouth. It's pink and moist. His tongue is even and long. And it looks like you got a few cavities there. Do you eat lots of candy?
Yeah.
Have to remember to brush your teeth. I could also use my tongue blade to test his gag reflex, but I'm not going to do that today. While I'm at the face, I'm just going to feel his nose, see if I feel any swelling, which could be a sign of illness. I'm also going to have you push up on my shoulders. Good, nice and strong. Next, I'm going to move on to the arms. So first, I'm going to have you just rotate them in circles. Do you have any pain?
No.
No? Good. You can roll the other way, and then up, and down. Good. Can you go ahead and take off your shirt for me? I'm just going to look at your belly and your arms and listen to your heart for a second. I'll be fast. I know it's kind of cold. So I'm just going to feel your arms. They're nice and warm. You have big muscles, and they're even all the way down. Does it hurt at all when I touch your arms? No? Okay, good. Can you bend your arms up and down like this? And then move your wrists in a circle. Good. And now I'm just going to feel your pulses, which is your heartbeat. So I'm going to feel them in your, this is called the brachial, and then the ulnar, and the radial. And those are even bilaterally and symmetrically, and they have got a pulse rate of 2, which is what we're looking for. Next, I'm going to have you put your hands out. I'm going to look at your hands. You have 5 fingers on each hand, which is good. Your nails are nice and short, and I don't see any signs of dryness. Can you go ahead and squeeze my fingers as tight as you can? Good, and that just shows that his strength is equal bilaterally. And I'm going to take one of your, if you want to squeeze my finger like this. There you go. I'm just going to do that to you, and I'm going to watch as the blood refills in your finger. So you can watch together. So it'll turn white and then pink. Yours does it really fast, so that means you're extra healthy. So we're done with your arms and your hands now. We're going to move on to your chest and your belly. I'm going to start by just looking at you breathing. And it looks like you're breathing without any problems. Does it hurt? Do you have any problems breathing, or does it hurt? No? Okay, good. So I'm going to start by listening to your lung sounds using my stethoscope. It might be a little cold, but I'm just going to put it on your chest. And every time I move it, I'm going to have you take a deep breath in and then out. Okay? Nap time after this, huh? Okay, so I'm going to start at the clavicle and move down to the 6th or 8th rib. So every time I move my stethoscope, just take a deep breath in. Good. Good. Your lung sounds are nice and clear. You fill them up good with all the air you're breathing in. Next, I'm going to listen to your heart. So I'm going to do the same thing, although this time I don't need to have you breathe in and out. So it'll just take me a minute. When I put my stethoscope on the top part of your chest, I'll hear the dub sound, and on the bottom, I'll hear the lub. So when I listen to your heart, it sounds like dub lub, dub lub, dub lub. And I would listen to the 4 listening posts starting at the apical, or at the apical, the tricuspid, the apical, the pulmonic, the tricuspid, and the mitral. And at the mitral, I would listen to a minute to get his heart rate. Hopefully, it would be somewhere between 70 and 110 beats per minute. Next, I'm going to have you turn around, and I'm going to listen to your lung sounds in the back of your chest. Okay. So here, I'm just looking at the shape of his chest, that it's even and symmetrical as well. And the anterior thorax, and I see that he doesn't have any problems breathing, there's no retracting. Okay, just like last time, Zaid, I'm going to have you take a deep breath in and then out every time I move my stethoscope. Okay, good. You can turn back around now. So when I listen to the lung sounds in the back, I would start at the top of the scapula and move down to the 10th or 12th rib. All right. Next, we are going to look at your chest and your abdomen. I'm going to move these papers over here. I'm going to have you lay down on your back, and I'm just going to listen to your belly with my stethoscope, and kind of push around and see if it has any pain. Do you have any stomach pain right now? No? Okay, good. So first I'm going to start by listening. Just going to listen about 5 to 10 seconds in each spot. I hear lots of food moving around in there. Good. Now I'm just going to push on your belly a little bit, and you let me know if it hurts at all, okay? No pain? Good. Okay, what if I push on your bladder? Does it hurt there at all? No? Good. Okay, you can go ahead and sit back up. All right, now that we're done with the top half, so you can put your shirt back on, so you stay nice and warm. Now I'm just going to look at your legs and your feet, and we'll do a few more exercises and we'll be finished, okay? At this time I could also look at the genitalia, the rectum, if that was needed in the doctor's order. I'm going to start with your legs. I'm going to have you, can you stick them out in front of you? And then push them back in towards the couch. Good. Do you have any pain when you do that?
No.
No? Can you roll your ankles in circles? Good. Any pain when you do that?
No.
And you can wiggle your toes? Good. Okay. Just going to feel your legs. Do you have any pain when I touch them at all?
No.
No? And they're warm to touch, which is good. What about your knees? Any pain there?
No.
No? Okay. Ankles?
No.
No? And I'm going to, just like I felt your heartbeat in your brachial and your ulnar and the radial pulses like I was telling you earlier, I can feel it the same in your feet. So here I have, it's called your posterior tibialis, and I can feel that that heartbeat is even and equal, and then I have your dorsalis pedis, and it's also equal there. So you can feel your heartbeat in a couple different areas on your body, and that's called your pulse. Next, I'm going to look at your feet. I don't see any signs of dryness. They're well clean. I'm going to, just like I pinched your finger, I'm going to pinch your toe and watch that blood refill back into your toenail. And that was really fast too, so that's good. I'm also going to test something called your sensation, which means how if you can feel my sharp and my dull end of my stick. So this is my soft end, and this is my pointy end, okay? So what I'm going to do is I'm going to put it on a different couple places on your arm